All right, let's put on our detective hats for this one. We're about to dive into a medical case where the clues are, well, they're tricky. They're subtle. The symptoms seem to vanish into thin air, and you know what? A life is absolutely hanging in the balance. So here's where our mystery kicks off. We've got these two really alarming symptoms: transient weakness and slurred speech. But here's the thing: one moment they're there, and poof, the next they're gone. So what's going on here? What does that even mean? And that right there, that is the big question we have to figure out. Is this just some minor, random episode you can kind of brush off? Or is this the body screaming out a final warning sign before a complete catastrophe? Okay, section 1, a warning sign. You know, every good investigation has to start with a profile, right? So let's meet our patient and check out the signs that kicked this whole thing off. All right, let's pop open the file. Case number 20251220. What do we got? We've got a 67-year-old male. Okay, history of hypertension, high blood pressure, and hyperlipidemia, which is just a fancy way of saying high cholesterol. And the symptoms that brought him in? Yep, those same fleeting episodes. Right arm weakness and slurred speech. And look at that blood pressure, 150/90. That's definitely on the high side. So this is our starting point. All right, section 2, the search for clues. Now that we have the basics down, it's time to start looking for some real evidence. We gotta find the clues that are gonna point us to what's really causing all this. And boom, we get our first big break during the physical exam. The doctor puts a stethoscope on the patient's neck and hears something called a carotid bruit. Now, what is that? Just imagine the sound of water trying to get through a garden hose that's got a big kink in it. That weird whooshing sound? That's a classic textbook sign that blood flow in a major artery, one going right to the brain, is getting seriously, dangerously squeezed. So to check out that suspicion, they do an ultrasound. And the result? Whoa, it is absolutely staggering. We're talking a 70% blockage, the medical term is stenosis, in that right carotid artery. Think about that. That's the main highway for blood getting to the brain, and it's nearly shut down. This isn't just a clue anymore, folks. This is the smoking gun. And this is where it all starts to click into place. This chart shows us why this blockage is even there. Take a look. The patient's bad cholesterol, that's LDL, it's way up at 160. Normal is supposed to be under 100. So all that extra cholesterol, that's literally the gunk, the raw material that's been building up this plaque and causing that massive 70% blockage. Okay, section 3, solving the diagnosis. Let's lay out all our evidence. We've got the patient's history, right? We have the physical clue, that whooshing sound, the bruit. And now we have the hard data from the ultrasound and the blood work. It's time. Let's connect these dots and finally name our culprit. And here it is, the official diagnosis: symptomatic carotid stenosis. So let's just break that down real quick. Carotid stenosis just means the carotid artery is narrowed. But that word symptomatic, that's the real kicker. It means this blockage isn't just sitting there quietly. Oh, no. It's actively causing those terrifying stroke-like symptoms we saw at the beginning. Let me give you a really simple analogy. Imagine the main fuel line going to your brain's engine is 70% clogged up. That slurred speech, the arm weakness, that's the engine sputtering. It's struggling, and it is screaming at you that if you don't do something and do it fast, a complete shutdown, a massive stroke is not just possible, it's pretty darn likely. All right, section 4, a critical decision. So the diagnosis is crystal clear. The danger is very, very real. So now we get to the most critical part of this whole case. What do we do about it? What is the right way to step in and fix this? So we've got 5 potential options on the table. You've got A, surgery called Carotid Endarterectomy. Then there's B, anticoagulation therapy. C is just lifestyle changes. D is statin therapy alone. And E is just, well, observation. Wait and see. But here's the thing. For this very specific, very high-risk situation, only one of these is the correct answer. Okay, let's start by ruling some things out. We can pretty much take the passive approaches right off the board. So just observing or only relying on lifestyle changes or statins, not going to cut it. Look, those things are absolutely important for long-term health, but they do not fix a huge 70% physical blockage that is already causing symptoms. The risk of a stroke is just too high and way too immediate for that. So what about anticoagulants, blood thinners? How do those stack up against surgery? Well, anticoagulants are fantastic for certain things, like preventing clots that come from the heart because of AFib. But that's not our problem here. Our problem is a fixed physical blockage. It's basically a rock in a pipe. Using a blood thinner is like trying to dissolve that rock with a chemical that's designed to treat rust. It's just the wrong tool for the job. Surgery, though, that's the right tool. It goes in and physically removes the rock. So, Section 5, the path to prevention. After looking at all the evidence, after ruling out the options that just won't work, we've arrived at our final verdict. We found the one path that directly takes on this danger and stops a catastrophe before it happens. And the answer, the most appropriate management for this patient, is A, carotid endarterectomy. This surgery is the right call because it goes right after the life-threatening blockage that we found. And when you think about it, the logic is just, it's perfect. Why surgery? Because the patient is having symptoms from a physical 70% clog. The surgery goes in and physically removes that clog. Simple as that. It restores the blood flow, and it dramatically reduces the risk of a major stroke. It fixes the problem at its source. And the surgery itself is actually pretty straightforward mechanical fix. It's really just 3 steps. Step 1, the surgeon gets to the artery. Step 2, they literally take out the plaque that's causing the problem. And step 3, they close it back up, restoring the flow. That's it. A clear highway for blood to get to the brain is immediately reopened. And just like that, case closed. But this whole story leaves us with one last, and maybe the most important, question. This patient's story is a huge lesson that symptoms that come and go can be a final warning sign. So it makes you think, right? What fleeting symptoms in our own lives or in the people we care about should we absolutely never, ever ignore?